Hi, it's Dr. McCarthy here, and I want to welcome you to the 12 Days of Christmas health tip for today. Today we're going to talk about a condition that we see a lot of in our office called increased intestinal permeability. It's also known as leaky gut syndrome. Basically, in a normal functioning intestine, there's miniature tiny holes in between the inside of your intestines and your bloodstream. Little tiny molecules will pass right through these junctions, get into your circulatory system, and be carried around where they need to go. Little tiny pieces of amino acids, minerals, vitamins, enzymes, and it goes wherever it needs to go. It's deposited. That's a normal functioning system. Sometimes, however, these spaces here in between the cells can become significantly widened, and it allows larger pieces of molecule to get through, larger foods, larger proteins to get through. When that occurs and it gets into your circulatory system, your immune system will identify this large protein as a foreign invader and will actually start to attack it like an autoimmune condition. And then what happens now is every time you eat that food, it perpetuates the hole in your intestines and it flares up your immune system. Where do you get this leaky gut to begin from? Why does this occur? One of the main things that we see are food sensitivities. Some of these large molecules that can pass through your gut create the leaky gut and then pass through and flare up your immune system. Things like casein, the protein in milk, gluten, the protein in wheat, soy protein. These are all very common food sensitivities. We can also see it from a chronic bacterial infection. If you've got a bacterial infection that goes on and on and on for months inside your intestines, this can lead to the leaky gut as well. Another way you can see it is people who take antibiotics very frequently, especially little children, take it very frequently for recurring ear infections or such. What happens is it wipes out the good bacteria that lives inside your intestines and creates that leaky gut. So what we need to do in order to correct this situation is twofold. The first thing you need to do is you need to get rid of what's causing the leaky gut in the first place. If it's an infection, we need to eradicate that. If it's antibiotics created poor population of the good bacteria in your intestines, we need to repopulate your intestines, probiotics. If it's an autoimmune condition, we need to modulate your immune system. We need to improve the function of your T regulatory cells so that we can stop the attack on the lining of your intestinal wall. Secondarily, we need to fix that part. Secondarily, we need to repair the walls of your intestines. If we don't, then you're going to have this continued leaky gut situation. This is a very severe, very serious problem, and if not handled, you cannot fix your chronic health condition. This is something that we do in our office, something that we're very comfortable taking care of. If you would like some more information on leaky gut syndrome, I urge you to call my office, tell Kathy that you saw this video, and I'll talk to you soon. Thanks.